what are some lifestyle changes that people should be looking into to keep the carotid artery disease from progressing?
So that's a very important, I think this is probably the most important question for our audience today.
Well, first, quit smoking. We already established that one.
Well, isn't that the obvious one?
That's the obvious one.
You know, I can't say that we have absolute control, because I've met patients who are very, very addicted to cigarettes.
Right.
And even though they've had several procedures, it's very hard for them to quit.
It's very difficult.
They understand it, they know it, yet it's very hard for them to stop.
I know.
Cigarettes are very addictive, and it's easy for us to say, okay, just stop smoking. It's a different thing for the patient.
Absolutely.
You need chemical support, you need emotional support, you need support from the family, from the community, and so forth. So it's a big deal, but it is a big deal to stop smoking. You know, it'll change what will happen to you 10, 20 years from now. So that would be one thing. The other thing, let's think about this for a second. You know, when you change your diet habits, you look at statistics of vegans, for example. The risk of diabetes in vegans is 3 times less than in the people consuming the average American diet. So you get about 7.5, 7.8% risk of diabetes in the carnivores, so to speak. Mm-hmm. The vegans will be about 2.5%. You decrease it by threefold.
That's substantial.
All right. So there, 130,000 deaths from strokes every year, about 30 or 40,000. Because of carotid disease, the remaining from other causes, hemorrhagic stroke and so forth, AFib. But from those 30, 40,000, you take away maybe a factor of 3. Mm. And then let's say from the remaining ones, the 10,000 that are left, they stop smoking. So you take another 5,000 out of that,
And then add in some exercise, and now we're really talking.
Right. So, it is really the bad habits that we have, that we're doing today, that will affect us 10, 20 years from now.
Right.
So that's what we all need to think about.